On this day, 26 June 2025, International Day Against Drug Abuse. The theme for this year is Breaking the Chain, Treatment, Prevention and Recovery for All. People who are under drug abuse. I will tell the concept based on the numbers, 12 numbers, that is based on the cranial nerves. 12 senses are there. So with respect to cranial nerves, so the first cranial nerve is olfactory nerve, that's a sense of smell. So if you smell something bad among your friends and relatives, that is with respect to the drug, kindly inform the NCB, that is Narcotic Control Bureau, toll free number 1933. Then if you see second cranial nerve, that is optic, through your vision, if you see something, somebody is dealing with drug, somebody is consuming drug which is banned, okay, these drugs has to be informed to the NCB. Third cranial nerve is oculomotor, fourth is trochlear, to move the eyeball like this, and the sixth is abducent, if you see silently like this. So third, fourth and sixth help in the movement of the eyeball, oculomotor, trochlear and abducent. So if you are vigilant enough while walking in the road, while going for a walk, or while taking the dog out, if you observe any drug peddlers, kindly inform the Narcotic Control Bureau, toll free number 1933. The trigeminal nerve, that is a sensory nerve, main sensory nerve of the face, the ophthalmic, maxillary and mandibular division. The mandibular is also motor to the muscles of mastication. So if at all, if you suspect somebody chewing some narcotics, so that time muscles of mastication, mandibular division of trigeminal nerve, kindly inform the narcotic department. Then seventh cranial nerve is facial nerve, that supplies the muscles of facial expression and also the taste in the anterior two-third of the tongue, except the circumvallate papillae. So if somebody is tasting the narcotics, it's tasty in the initial phase. Once they get addicted to that, then they are going to steal at the home. In home, whatever is possible, they will steal for the money, and if not at home, at outside, so they will become criminals. Or they can go to certain extent that they may stab their own parents and siblings for money, actually. So the taste of narcotics is bad in such a way, it will spoil not only the individual but the entire family. Eighth cranial nerve is auditory nerve, the vestibulocochlear nerve. If you hear somebody talking about the narcotics or a drug peddler or some drug dealing, kindly inform the Narcotic Control Bureau 1933, toll free number, you can call 24/7. Your identity will be kept confidential. They will not reveal who has called them, but those people who are drug peddlers, they will be dealt appropriately. So kindly inform the narcotic department. Ninth cranial nerve is glossopharyngeal nerve, again the taste, carrying the posterior one-third of tongue and also supplies pharynx muscle, stylopharyngeus. This glossopharyngeal nerve is helping the tasting of the narcotics. Once again, it's a taste, so initially it will be good, but subsequently when they get addicted, it will spoil the entire family. The 10th cranial nerve is concerned with vagus nerve. It is concerned with the entire supply of the gastrointestinal tract, the respiratory tract, the heart and other visceral organs. So this vagus nerve, what happens when they consume drugs, the digestive system is affected, they will have bloating sensation, they get severe gastritis, intestinal ulcers, and constant craving will be there for the drug, for the effect of euphoria. So the vagus nerve or the 10th cranial nerve will also get affected. The 11th cranial nerve, moving on, accessory nerve. It will supply the sternocleidomastoid, oblique muscle of the neck, and the trapezius, triangular muscle on both sides. If it combine, it will become rhomboid shape. So this is supplied by accessory nerve, spinal accessory nerve. So whenever we are dealing with narcotics, we can't just shrug off the problem. It will not go so easily. So we have to handle these patients carefully and treat appropriately and do de-addiction for them. Better to prevent from going to the addiction. Otherwise, we have to treat so that everybody will become healthy. So the society entirely, if it becomes healthy, the crime rate will reduce. So that is the importance of 11th cranial nerve or accessory nerve. Last but not the least, the 12th cranial nerve or the hypoglossal nerve. It is the nerve which supplies the tongue muscles. It will come underneath the tongue and supplies all the muscles of tongue. So whenever you see such violence with respect to narcotics dealing or any violence created by such criminal dealing with narcotics, we have to use our tongue to speak out the truth. For the Narcotic Control Bureau, we have to call 1933. Narcotic Control Bureau and the police department will fight against the drug abuse, and also with those people who are drug peddlers who are dealing with the drugs. From the root, if you remove all these things, we will get a healthier society. So this is in detail about the 1st-12th cranial nerve and how we can remember how to deal with the narcotics. This is about the importance with respect to the International Day against the drug abuse or the narcotics agents. Thank you for watching and learning from Logic Medical.